Now moving on to the health scene, where warning ahead of the dry season, the Nigeria Center for Disease Control (NCDC) has issued a dual public health alert on the rising threats of Lassa fever and meningitis outbreaks across the country. The Director General NCDC, Dr. Jide Idris, addressing journalists in Abuja, painted a grim picture of the Lassa fever situation, noting that Nigeria recorded 1,067 confirmed cases in 2022, which escalated to 9,155 suspected cases and 1,002 confirmed cases in 2023, resulting in 227 deaths. According to the DG, there is an ongoing effort led by the Federal Ministry of Health and Social Welfare and the NCDC itself to prevent, detect and respond to Lassa fever outbreaks across the nation by improving surveillance, community awareness and environmental degradation.
We have continued to see a steady increase in the number of states reporting Lassa fever cases, as it does this year. And the rise is due in part to improved surveillance, better community awareness, environmental degradation from climate change, and other harmful human activities. While we continue to intensify efforts using all of society approach, the public is hereby advised to note that the virus spreads through. We need to let the public know how the virus spreads. It spreads through direct contact with urine, feces, saliva, or blood of infected rats. That's the Malta marmot rats. It spreads through contact with objects, household items, and surfaces contaminated with urine, feces, saliva, or blood of infected rats. Consuming water or food contaminated with the urine, feces, and saliva or blood of these infected rats. And more importantly again, person-to-person transmission can also occur through direct contact with blood, urine, feces, the vomiters, and other body fluids of an infected person. Cover your dustbins and dispose of refuse properly. Communities should set up dump sites far from their homes to reduce the chances of entry of rodents into their homes.
On the threat of meningitis, Dr. Idris warned that the disease, which causes acute inflammation of the brain and spinal cord, is also endemic in Nigeria, with cases reported year-round. However, he noted that dry season conditions characterized by dust, winds and cold nights can increase the risk of infection, especially in crowded, poorly ventilated areas.
In 2023 and 2024, Nigeria recorded about 4,915 suspected cases, with 380 confirmed and 361 deaths across 174 local government areas. So advice to the public: ensure you and your loved ones have received the appropriate vaccination required to protect against meningitis, because we're lucky there is a vaccine for meningitis. Avoid close and prolonged contact with the confirmed case of CSM, including the relatives. Avoid overcrowding on households, schools, dormitories, IDPs, and prisons or other communal settings. Interestingly, we can have more cases of meningitis in prisons. You know, these prisons are overcrowded. They have very poor environmental, whatever it is we have. Practice proper respiratory hygiene when coughing or sneezing. Discourage indoor air pollution, such as indoor cooking over open flames. Practice good personal and hand hygiene by frequently washing your hands with soap and under running water, or using hand sanitizers. And always keep your environment clean. Visit the nearest healthcare facility immediately if you notice any of the signs and symptoms you've enumerated.
The Director General urged Nigerians to maintain clean homes, block entry points to prevent rodents, and securely store food in rodent-proof containers, dispose of refuse properly, and keep garbage far from homes. For healthcare workers, he also stressed the importance of personal protective equipment to reduce risks.